Did you know that recently the World Health Organization updated the Bacterial Priority Pathogen List 2024, bacterial pathogens of public health importance to guide research, development, and strategies to prevent and control antimicrobial resistance? And this information may impact your daily clinical practice. Hi everyone, I'm Professor Esparza, specializing in clinical microbiology and antimicrobial agents at Pontificia Universidad Javeriana in Bogotá, Colombia. Welcome to this episode of the Labknowledge series called Mastering Antibiotic Resistance Challenges. This series is presented in collaboration with the Labknowledge Institute. Today's episode is about the updated list of priority pathogens from the World Health Organization. I hope you enjoy it. The 2024 WHO Bacterial Priority Pathogen List is an important tool in the global fight against antimicrobial resistance. This update on May 17, 2024 refines the prioritization of antibiotic-resistant bacterial pathogens to address the evolving challenges of antibiotic resistance. The list categorizes these pathogens into critical, high, and medium priority to inform research and development and public health interventions. The list covers 24 pathogens spanning 15 families of antibiotic-resistant bacterial pathogens. The inclusion of these pathogens underscores the global impact in terms of burden, as well as issues related to transmissibility, treatability, and prevention options. It also reflects the research and development pipeline of new treatments and emerging resistant trends. So, which are the pathogens included in this priority list? In the critical group, we have third-generation cephalosporin-resistant Enterobacterales, like ESBL producers or AMC producers, and carbapenem-resistant Enterobacterales, like KPC and NDMs. Also, carbapenem-resistant Acinetobacter baumannii and rifampin-resistant Mycobacterium tuberculosis. In the high group, we have fluoroquinolone-resistant Salmonella, fluoroquinolone-resistant Shigella, vancomycin-resistant Enterococcus faecium, third-generation and fluoroquinolone-resistant Neisseria gonorrhea, and methicillin-resistant Staphylococcus aureus. We have also here carbapenem-resistant Pseudomonas aeruginosa, which was removed from group critical. In the medium group, here we have macrolide-resistant group A Streptococcus, penicillin-resistant group B Streptococcus, ampicillin-resistant Haemophilus influenza, and macrolide-resistant Streptococcus pneumoniae. What should I know about these bacterial pathogens in my daily practice? 3 points must be discussed here. First, they are frequent in some institutions, like in the Caribbean countries. For example, the LBLs and now the carbapenem-resistant Enterobacterales, Pseudomonas, and Acinetobacter. They cause mainly hospital-acquired infections, but also can disseminate, generating outbreaks associated with higher morbidity, mortality, and costs. Second, the treatment options are limited, especially for severe infections like bacteremia and pneumonia. There is a lack of new drugs in the Caribbean to treat our patients. In this sense, physicians are obligated to use combination therapy, including some toxic drugs like polymyxins, aminoglycosides, and tigecycline. It is also important for countries and medical institutions to consider bringing new drugs to the hospital formulary. Third, tackling these pathogens requires an integrative approach, strengthening diagnosis, improving access to effective therapy, and implementing infection control and prevention interventions. So what is the role of the diagnosis in mitigating the impact of priority pathogens? Diagnosis is a cornerstone in the fight against multidrug-resistant priority pathogens, as it allows for the application of contact precautions, the administration of effective targeted therapy, and the sustenance of a surveillance network. Identification may be performed using the multi-top spectrometry. For example, the use of the Vitek MS allows prioritizing slides coming from critical hospital services. Multiplex PCR with a syndromic approach like the film array system, or biochemical methods using the Vitek 2 identification cards. Antimicrobial resistant genes may be detected using the film array method. Phenotypic resistance may be detected using colorimetric methods like the Rapid Carba MP and commercially available broad microdilution like the Vitek 2 system. What strategy should I apply to report results in this priority group? It is important to design a strategy from the perspective of antimicrobial stewardship and infection control. For example, you may decide to streamline communication of results for the critical group, reaching out to attending physicians to optimize antimicrobial therapy. For the high group, I would recommend reporting immediately, specifically for infections like bacteremia and pneumonia, or for institutions attending special patient populations, for example, immunocompromised or transplant patients. The medium group may be important for some geographic specific locations and should be dealt with accordingly. Remember, the World Health Organization Priority Pathogen List is an important tool to develop strategies aimed at mitigating antimicrobial resistance. Diagnosis and communication are fundamental in this objective. Without diagnosis, this bacteria will continue to spread and antimicrobial resistance will evolve. Thank you for watching this episode of Mastering Antibiotic Resistance Challenges. If you found this content helpful, please give it a thumbs up, subscribe to our channel, and hit the notification bell so you never miss an update. Together, we can make a difference in preserving antibiotic efficacy. See you in our next episode.